DAC, Defensive Antibacterial Coating. DAC is a Class 3 medical device compatible with any uncemented joint prosthesis or trauma device. The DAC acronym describes the main features of the hydrogel. Defensive, specifically designed to deliver a preventative action. Antibacterial, able to have not only a primary antibacterial passive action, but also, if needed, to exercise an auxiliary active one. Coating, created to act as a chemical physical barrier against bacterial colonization. The DAC hydrogel is the result of research that was undertaken following a specific strategy with clear objectives. Produce a bioabsorbable hydrogel able to act as a temporary hydrophilic barrier for an implant hydrophobic surface coating. To be reabsorbed rapidly enough to avoid any interference with new bone formation and healing processes. To be compatible and able to be reconstituted with a range of bioactive agents, allowing their release during the reabsorption process. The primary objective is to win the so-called race for the surface, preventing pathogens from colonizing the implant. For this reason, the DAC hydrogel has been designed as a temporary chemical physical barrier, keeping the bacteria in planktonic form. A secondary objective is to allow the release of antibiotic agents in very high concentrations at the implant surface level. In this way, an effective antibacterial effect can be delivered against the onset of infection, even when traditional systemic prophylaxis does not seem to be successful. The chemical physical barrier must be temporary. The hydrogel must be reabsorbed and disappear quickly enough in order not to interfere with the bone healing processes. In practice, the DAC hydrogel is spread over the entire surface of the joint prosthesis or trauma device immediately prior to implantation.